Kaselj from exercisesforinjuries.com. I'm down here in San Diego, sunny and windy San Diego. I'm at a fitness mastermind meeting, and I've got another interview for you. I think this is like the 13th one. So I keep grabbing people from the meeting and taking them outside and doing a quick video with them. And I'm really excited about this video because we were talking, John and I were talking at the last time we met, which was in Costa Mesa in March, and we got talking about like the effectiveness of medication. So I'm going to get John to introduce himself, and then he's going to kind of talk about like what level of effectiveness is what okays a medication to go on the market. Okay, so
yeah. So those of you who don't know me, and there may be a lot out there, but my day job is I'm a pain physician, sports medicine, and rehabilitation specialist, and also run a site called thepainfreediet.com, where we work to educate people on the best combination of lifestyle changes through exercise prescription like Rick does, dietary changes, sleep hygiene, stress reduction, all these things we know that are very powerful interventions for getting through an injury, recovering from a painful episode, and just reaching that optimal level of function and performance. So that's what I do. And the question that Rick laid out there is, when we talk about medications and using those as an intervention, say we'll just use the concept of pain medications as we typically use in my practice at certain points is what I call a bridge treatment. So if somebody comes in with a very painful episode, we need to get their pain under control so that they can go work with somebody like Rick, do the exercises they need to, and over time as they heal, come off those medications. But the point that we were talking about a couple of months back is what really is a successful medication trial, if you will. So when they're developing these medications, they want to get them out to the marketplace and say, how effective is this medication over, say, a sugar pill or a placebo? We think in our minds that, man, these are wonderful things and it should help 75, 80%, or maybe, probably not 100%, but maybe 75 or 80% of patients who get this medication is really going to have a dramatic impact. And in fact, it's much less. It's about on the order of 30%. So 30% improvement for the aim that they're going for with that medication. In our example here, pain reduction, gets a whole room of executives high-fiving and popping off champagne corks and just slapping each other on the back. So it's far less than we might think. It still, of course, is an intervention that we use and can be quite helpful for those reasons to allow somebody to get along that path of recovery and working on their exercise program diligently in that. So they do have a role, but I hope people see that it maybe isn't the whole thing or the role that they maybe put stock in of that being the only treatment to get out of pain. So just a small portion of it.
Awesome. I mean, I think that's fascinating information. I didn't know that, and it's very insightful to get that bit of information. So John, where can people get more information about you?
So coming soon to basically thepainfreediet.com is going to be our homepage for getting what we feel to be the best information into the hands of people for dietary approaches to treating pain. Programs like Rick's, of course, will have links to his information too. But finding people that really deliver the truth out there, try to distill down the massive amounts of information in regards to just recovering from pain or getting through an injury or living at a high level of function or performance. Because in my mind, when I think about performance, we naturally think the athlete, and of course we both see a lot of those people, but for me, performance is also the elderly person that just needs to get out to their mailbox, or they end up on the floor and have to get off the floor. So we really want a site that people could go get information. Rick and I have a passion for reading thousands of journal articles.
Passion, sickness,
And a little bit of a sickness, but then distilling that information down into very usable points, so you don't have to do all that reading yourself. So that's really what we feel that site's going to be with time. Really be a place for people to find that great content and information.
Awesome. Thank you very much, John. And make sure to swing by exercisesforinjuries.com. I have a more thorough interview with John that I had done with them, talking about the pain-free diet, and then also his partner Nick Pinot. I did an interview with him as well, so you can go on the blog and listen to those interviews. And also you can go to the blog and type in your injury, and there's a good chance you'll find an article or video on your injury and how exercise can help. If you're watching this on YouTube, head above and hit the subscribe link. What that'll do is you'll end up getting videos like this every couple of days, and where I kind of talk with experts like John and about injuries and exercise. So this is John and Rick Kaselj from San Diego saying take care and bye-bye.